Hello everyone, this is Chadi Alraies from CVI 2022. With me is Dr. Leslie Ynalvez. She is second year junior cardiology fellow at UT Houston. Leslie, thanks for being with us.
Yes, Dr. Chadi, thanks so much for having me.
Sure. So you presented, you're one of the challenging case presenters, and Dr. Salman Arain told me about hard work and how much dedicated you are for interventional cardiology. Tell us about the case.
Yes, sir. So our case is actually unique out of the peripheral cases because it was dealing with a subclavian vein thrombus that's related to a pacemaker device.
Yeah. And how did the patient refer to you and what the patient presented with?
Yes, sir. So the patient, he received his pacemaker about 15 months before his symptoms started. At first, he's been doing well after those 15 months, and then he suddenly, quite acutely, got 2 days of his left arm started swelling, and then suddenly it got to a point that he developed what's called a post-thrombotic syndrome, meaning it got so bad that he couldn't move his arm anymore, and he really enjoyed golfing, and so he had to stop that as well.
Oh, okay. And what was the diagnosis made?
Yes, sir. So what he got a duplex Doppler of that arm, and they found that he had indeed a subclavian vein thrombus.
Yeah.
And then once they found that out, he was at first started actually with, of course, the cornerstone of therapy, which is anticoagulation with apixaban. However, despite 7 days on that, his symptoms got worse, and he was very debilitated, couldn't even comb his hair.
Oh, wow.
And so we decided that the best course of action was to actually try a mechanical thrombectomy. And our kind of approach to it was we didn't know it was going to be a two-prong. We came in there with the planning thinking that we're going to try an aspiration thrombectomy with a penumbra device. So penumbra devices actually work with really this powerful mechanical aspiration where if you look at the video, it just kind of sucks out all that clot in a very powerful manner. However, I think his thrombus burden was so bad that it wasn't enough. He still was very stenotic. And so we had to kind of stop and think in the case and say, okay, we're gonna have to do an additional balloon angioplasty, and we had to balloon the stenosis. And then after that, we got a flow that we were very happy about.
So the penumbra was the size was CAT RX, the coronary penumbra, or it was CAT 6, 7, or 8?
Yes, it was actually the Lightning. The Lightning. So we used a pretty big access, which was a 14 French venous sheath.
In the groin?
In the groin.
Going up.
Exactly. So what we did was, it was a pretty cool case because I've never seen something quite like it. You really had to plan it out because of the kind of the technical strategies. So we had to, because his thrombus was in the left subclavian, so we had to get access first on the brachial and then shot the subclavian, and then we got a stork wire traveling from the left side, and we advanced it towards the contralateral right fem. So once it's in the right fem, we worked on the penumbra, now on the right femoral side. Once the penumbra is there, we used actually the snare catheter. So we kind of snared that stork and grabbed it. And when you grab it, it creates this railing. And so it creates this railing for the penumbra to kind of go all the way up into the subclavian from the femoral. So it was really cool, especially
almost like flushing the arm and the leg.
Exactly, yes, sir. And it was an interesting technique, especially as a first-year fellow, because I've never seen something like that.
And you presented today, or
today? Yes, sir. I presented today, and then tomorrow I'm actually going to be in the finals to present the case.
Nice,
so
congratulations. So what do you think about CVI?
Oh, I love it. I came in here, a general cardiology fellow, and then
you didn't know what to expect.
I didn't know what to expect, but it's so exciting because even though I know very superficial of it, I can only imagine how much work it was to gather all the experts in one place and then to actually teach us fellows is also another step that's an advantage from other gatherings.
Oh, that's great. I'm really excited. Thanks for being with us, Leslie.
Thank you so much.
Congrats for being a finalist. Hopefully you will finish
you.
as a finalist as well. And as you know, if you win, you'll become a standard faculty going forward in this meeting.
That'll be awesome.
Yeah. Congratulations again. Thanks for being with us.
Thanks, Dr. Chadi.
Yeah, and please watch these videos and others on YouTube channel for CVI. This is Chadi Alraies from Denver, Colorado. Leslie, thank you so much.
Thank you, sir.